I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. Dr. Jorge Machicado is a clinical assistant professor in the Division of Gastroenterology and Hepatology at the University of Michigan. Dr. Machicado earned his medical degree in Lima, Peru, and received a Master's of Public Health at Johns Hopkins Bloomberg School of Public Health. Dr. Machicado's research focuses on epidemiology and clinical trials in pancreatic disorders. He has authored over 70 peer-reviewed articles, most of them on pancreatitis and pancreatic cysts. He has been recently selected as a Forward Scholar by the American Gastroenterological Association, which aims at supporting physician scientists and future leaders in GI from underrepresented populations. The Bonnell Foundation gave Dr. Machicado and his team a $5,000 grant to help study gut pain in people with CF. It's a long pilot program similar to a clinical trial. This is a feasibility study. Dr. Jorge Machicado, I welcome you to this podcast. Thanks so much. We're really excited about this program that you're doing, and nice to see you sort of in person.
Thank you so much, Laura, for the invitation to be in this podcast.
When I talked with Dr. Matthew DiMagno, he's so excited about this program, and I'm so glad that you can do this podcast. Tell us, what is the issue with the gut that you're studying?
Absolutely. So our focus here in the University of Michigan is that we are working on pancreatitis issues. We have a comprehensive pancreas center, and we know that patients with chronic pancreatitis experience a pain from different causes that can be very debilitating, long-term, and can affect their quality of life. So because of these issues, we really focus our efforts to try to find strategies to evaluate and treat pain better in a multimodal approach, and try to find new technologies that can help us find ways for patients to improve their quality of life when they have chronic pancreatitis. So our focus is using a novel technology named transelectrical aqueous stimulation, which uses principles of acupuncture. So it's a special device that can be worn as outpatient. Patients can put this technology over different acupoints, and truly what it does is it gives electrical pulses and stimulation to help relieving different symptoms based on acupuncture points. So our goal on this particular study is to treat pain. So it goes directly into previously known acupoints that reduces abdominal pain. It has been studied well in other conditions such as irritable bowel syndrome, acute pancreatitis, gastroparesis. So based on that data, we are trying to see if there's any effect on pain reduction in patients with chronic pancreatitis.
And it really is almost like an out of this world. Like when you describe with the technique and what you'll be doing, it's so interesting and crazy how you scientists think of things. And I wonder why this is interesting to you and why you're so hopeful about it.
Thank you so much. So we have learned that patients with chronic pancreatitis can have pain due to different mechanisms. So we know that, for example, a fraction of patients have an obstruction of the pancreatic duct due to stones in the pancreatic duct. Sometimes we treat those with procedures such as ERCPs or surgery. But despite this intervention, many patients continue experiencing pain despite relieving that pressure in the pancreas. So there's definitely many other mechanisms that are playing a role in pain in our patients with chronic pancreatitis. It's not only the pressure in the duct or inflammation, but it's also several other components that may be related to nerves surrounding the pancreas, may be related to a perception of pain due to continuous triggering of inflammation in the pancreas, may be related to inflammation around the pancreas itself. So relieving the pressure of the pancreas may not necessarily fix those triggers of pain. So due to that, there is really different components that we can aim to treat pain. And one of those is this technology, which has the purpose of, again, through acupoints, acting on nerves, number one. So it can help on vagal and autonomic function, so kind of regulate the guts and the nerves. Number two, it can help with inflammation too. It has been noticed in prior studies in humans with pain that it can also decrease inflammatory markers. And number three, it can also help with some aspects that we also see in pancreatitis, such as sleep issues and other problems that can accompany pain in pancreatitis. So really what we're trying to do is bring to our field another technology that can help our patients with pancreatitis experiencing pain that is difficult to treat with other methods.
The people in your pilot program, some will have cystic fibrosis and some won't, correct?
Yes, absolutely. So really our study is open towards any patient with chronic pancreatitis, regardless of the etiology. Our focus is, again, to help patients who are experiencing pain due to a chronic pancreatitis. But really, for the future, we are considering, other directions of the study in which we can assess how to improve pain experience with other sort of pancreatitis issues as well.
This reminds me of how much science helps other diseases. It's important that it's not just cystic fibrosis because it could help another disease. And I love that it welcomes both. And I know from personal experience, my daughters are now 26 and 29, but the gut pain that they had for about 10 years of their lives was excruciating and horrific. And finally, we found Dr. DiMagno, and his help really got them through it. But I'm so hopeful that this will help others because it's a debilitating pain, right?
Absolutely. It is a pain that often ends up affecting a patient's quality of life, their ability to cope with sleep. They feel fatigued due to the pain. It can impair being part of the workforce. And really, we're trying to find different ways that we can help them. It's also amazing how when we look into the different gastrointestinal conditions that end up requiring opioids in the United States, chronic pancreatitis is at the top.
Wow.
So it's very concerning for us. And we're trying to, again, find ways in which we can offer individuals different ways to either decrease their opioid needs or perhaps even remove it if it's possible. But I think that science needs to move into the direction of finding ways that patients can live longer and without pain.
So this pilot program, is that correct to call it that? Are you still looking for people to participate in it? And if so, how do they get involved?
Absolutely. So Initially, it started as a small pilot program in which we aim to enroll 10 participants to look into how to study this device better. But we're going to expand a little more. We want to try to see how it really works into doing perhaps a small pilot randomized controlled trial. And we have been fortunate also, in addition to receive some scholarship from the Bonnell Foundation that helped us start this project. We're truly appreciative of that. We've recently also received support by the American College of Gastroenterology to expand this. And for the next 3 years, we're going to be studying this device and also finding other ways in which we can understand pain in chronic pancreatitis. So right now, the pilot is almost completed, but stay tuned because in the next few years, we're going to be enrolling more participants at the University of Michigan. So we will have probably some ability to recruit participants who want to participate from within the state or outside. And our study coordinator will be available with their information so they can be contacted in order to participate. But that's still in the works. More to come about that. But this is something that is very exciting for us because we are going to try to demonstrate whether this is helpful or not and how to use it.
So should people contact you yet, or should they wait until your next program?
I think that for patients who are being seen and are already established at the University of Michigan or want to start their care in the University of Michigan for a second opinion, currently we're definitely open to enrollment, to participants with that. The reason is we need to understand that chronic pancreatitis is not easy to diagnose. And we want to enroll participants with that disease in whom we know that they carry imaging changes of chronic pancreatitis that is compelling and that we know the eligibility criteria well to enroll them in the study. So currently, again, if patients are at the University of Michigan and have their care here, we definitely are open to enroll them either now on the pilot or in the future studies that are started probably after the summer.
Well, how are you feeling so far about the study? Are you excited? Like, what are patients saying? How's it going?
Absolutely. It's very exciting because this is pretty much a device that people can wear twice a day at any time, wherever they are. So they can be taking breakfast and just put the device and continue taking the breakfast. It's not painful. It doesn't cause discomfort. It's a wearable device that is connected with EKG leads into the areas that we instruct patients to locate it. We have had very good recruitment and compliance, especially because there's hope that there can be improvement in pain. And although this is something early, still in the process, by any means, it's something that we are ready to launch as a conventional treatment in clinical practice. It's important because it will give us some clue in how we can introduce new technologies in the future for our patients. So that's very exciting for us and also for our patients who are trying to bring hope for the future generations of patients with pancreatic pain.
It is really exciting. And do you talk to other scientists and say, hey, we're working on this? And is there interest from other areas other than, your gastroenterology areas?
Absolutely. We were, again, very fortunate to be funded by the American College of Gastroenterology, which is one of the largest societies in the United States for gastroenterology. So scientists reviewing our grant application were very interested about our technology and the work that we're doing because it can really, again, aim to tackle in part the opioid epidemic that we have in the United States as well, because it can really help patients either, prior to starting opioids or afterwards when they are, receiving it, but they continue having pain. That doesn't disqualify them to be part of this study. So they can still participate and see if this is an additional technology that can help them coping with their pain. So there's excitement from scientists outside our pancreas field. We work very close here at the University of Michigan with a pain center as well. There's a Center of Pain and Fatigue Research that is doing tremendous work on different pain disorders, such as back pain, pelvic pain, headaches, etc. And they have an armamentarium of ways to help patients coping with pain. So we hope to also be able to tap into some of those interventions to eventually be able to offer not only one technology, but offering hope to our patients into a diverse way to treat pain when other things have failed.
And so when this study is over, their lives are changed for the better, right? They're going to have more tools and an understanding of how it all works.
Exactly. So our goal is, now that we are almost finalizing a small pilot study, second phase of the study that will be a small randomized trial that will take us about 3 years. And if this still demonstrates to be effective, then we will move into a larger randomized trial, potentially with other centers in the United States, to assess if this technology is truly effective. What we know from other conditions is that this is safe. This doesn't cause any sort of major adverse events, since it's only a small current that is applied. It's very similar in principle to the TENS units, which are electrical stimulators that are applied in nervous locations, but with the difference that this is applied in acupoints. And again, it doesn't have any major adverse events. Sometimes there can be a little bit of discomfort or redness in the area where the electrodes are applied. But typically, if that occurs, we recommend patients can remove it and wait and do it in another session of the day. And this has demonstrated, again, a very high compliance and to be a safe mechanism to try to tackle pain.
And it must be part of why you became a doctor, to figure all of this out. But it seems so rewarding to see these results.
Exactly. I think that on my career, I'm dedicated to see and treat patients with pancreatic disorders. And there's nothing more rewarding than truly seeing that your intervention is helping patients to improve their pain, their quality of life, their ability to continue working and continue having hope, which is very important. We see many patients at the University of Michigan refer from other centers throughout the country where they haven't found other alternatives to treat their pain. But here, not only with conventional methods, but with research tools, we try to help them to see if there are better ways to treat their condition. So that is extremely rewarding. And I can tell you, like, even being foreign graduate, I did my medical school in Lima, Peru. And the hope that patients have in our home country is high expectations for care. However, there's not the ability to offer all the technologies that we have here in the United States. So I feel very privileged to have the ability to work at the University of Michigan and be able to offer tools that can change the landscape for treating difficult disorders of the pancreas for patients throughout the US and the world.
And the world. And that's one thing I've been discovering in the last several years is, I don't know, you just realize that not everybody has the same health opportunities. There's so much inequity. in between countries. So yes, this is a beautiful thing that hopefully everyone will have access to around the world.
Exactly. So that's, again, our hope is to do first the right science to make sure that what we're doing is helpful for patients. And, the translation of that takes many years. But again, I think that having that equity in care is extremely important for patients with pancreatitis in the United States and throughout the world.
And is there anything else that we didn't mention about this study that you think is important?
I think that we are still trying to also understand the mechanisms of this. As I mentioned, this can work towards the nerves. It can work decreasing inflammation. So it can help patients with chronic pancreatitis from different sources of the pain. But chronic pancreatitis can have different mechanisms for pain. So at the same time that we are working with this device, we're also trying to understand those mechanisms of pain in our research at the University of Michigan. So I think that that's also going to be very important to create a framework of how to select what is the appropriate therapy to give our patients with chronic pancreatitis.
I think when people hear this who have this pain, you're going to get hopefully a lot of emails or connections, because people will be so hopeful and are usually desperate, like we were, trying to get answers for your kids, or even if it's an adult who are in so much pain.
Absolutely. And that's very welcome by us. And we really hope that we can bring again this technology up to speed and conducting the proper research to make sure that this is something that it can help our patients. And if not, we will continue trying and we will continue working. I tell my patients when I see them in clinic, I do all my best to try to find alternative ways to help them through their experience with chronic pancreatitis. Because this is not only one thing tackles everything. We really need a multimodal approach in which we can help our patients.
Well, thank you for all you're doing. It's needed and appreciated, and I can't wait to hear the results of the study when it's complete. So thank you for everything you're doing.
Thank you so much, Laura, for the invitation for the podcast. And I want to thank again the Bonnell Foundation for all their support at the University of Michigan for this project.
You're welcome. And we want to do more. You guys, you're all doing great things. So thank you.
Thank you.
The original music in this podcast is performed by Kevin Allen,
It's not complicated.
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.